Hello, my name is David Trimberger, and I am completing my peer review and instructor checkoff for intranasal administration of medication. Okay, so sorry, I had the wrong one pulled up. So struggling to find an atomizer. I kind of made a makeshift one, so this is going to be my atomizer that I have. So starting off, I need to be assuring that my patient is being ventilated adequately if necessary. If my patient is alert, I can ask them if they have any known allergies. Clearly explain procedures to the patient, medication, find my materials, alcohol swabs, sterile gauze. Okay, cool. So starting off, making sure to keep adequate ventilations for my patient. Next step, what I'll be doing is I'll be gathering up all of my materials, so my medication, my syringes, find my atomizer, gloves, everything else of the sort. If my patient is alert, I can go ahead and ask them if they have any known allergies. So, do you have any allergies? No? Cool. What? I don't know. Not right now while I'm going through the 5. Okay. So starting off, first thing that I need to do is inspect my medication. So looking at it, make sure that the title of the medication is the title of the medication that I'm needing. Check to make sure that it's the right dosage, if I can give it the right route. So this one, see if I can give it intranasally. I will also inspect the medication for clarity, check the expiration date. And then I'm also going to want to make sure that I'm giving this at the right time, and this is the proper time that I should be giving this medication. Okay, did all that. Next, I need to assemble the syringe and needle while maintaining sterile. Okay, so I can go over, peel that back. This one. Peel it back. Okay. Set that aside. Undo the cap. Pull back 1 milliliter. There we go. Set that aside for right now. Going to clean top of my medication. Going to be using that for the next 5 attempts, and then I will start a new one for my new scenario. Set this down. Inject my 1 milliliter of air. Okay. Remove my needle. Get all the air bubbles out of it. Okay, and then in the actual real world, I would go ahead and I would recap this needle, but I'm going to be using it throughout the rest of my scenarios, so I'm going to go ahead and remove it and just set it aside for right now. After I've done that, and prior to drawing that up, I would also recheck my medication, dispose of my needle, put on PPE, and then this is the moment where I would stop any form of ventilation if needed. And then I would also go over to my patient, inspect their nostrils, make sure and determine which one is the largest, least deviated, or obstructed. And then next I could be able to take my atomizer, place it on, verbalize a syringe, mucosal atomizer, verbalize proper disposal of syringe, and briskly depress the syringe plunger. Okay, so then in this instance, I would go over, I would inspect my patient's nostrils, determine which one is larger, not deviated, and then I would go, alrighty, this medication is going to be inserted to your nostrils, so I'd go 1, 2, 3, and I would push all the way down, have all the medication inserted to the nostril, and then I would take my atomizer as well as the syringe, place it in my sharps container, and then I would immediately resume ventilation, and then I will observe my patient for any undesired side effects. And time to set everything back up. Okay. All right, so starting back over, I will make sure that my patient is being ventilated adequately. I will make sure that I have gathered up all my materials and the appropriate things needed. Next, what I will do is I'll find my medication, make sure it is the correct medication, make sure that it's the right dosage, I'm giving it at the right time, I'm able to give it intranasally, as well as I will check for clarity and the expiration date, and then I will use 2 patient identifiers to check with my patient. Next, I will assemble my materials, make sure that I'm trying to do it as sterilely as I can. Recheck my medication, clean the top of it, pull back 1 milliliter of air. Oh, you're all good. Inject it. What? Draw up my medication. Move all the air bubbles out. Okay, place this in the sharps container, grab my atomizer, put that on, set that aside. After I've done that, that's whenever I place PPE on, and then this is whenever I would stop my ventilations, go over and check with my patient. I will check their nostrils to determine which one is the largest, as well as see which one has the least amount of damage and is the least obstructed. Once I discover that, I will insert the atomizer into the nostril, and I will go 1, 2, 3, and push all the medication briskly. And then I will dispose of everything in the sharps container, and I will immediately resume ventilation and monitor my patient for any signs of non-desired side effects. Attempt number 2. Okay. And then we do it all again. Okay. Start off, gather all my materials, make sure that my patient is being ventilated adequately. Ask with my patient if they have any known allergies. And then I will explain to my patient that I am going to be drawing up a medication, inserting it into their nostrils, and then asking them to eventually breathe it in. So next, after I have gathered up all my materials, I will check my medication. I will look over it, make sure it's the correct medication, make sure it's the right dosage. I have the check to make sure that it can be administered intranasally. I will also check with my patient, have them give me 2 patient identifiers. I will inspect it for clarity as well as the expiration date. Yeah. And then after I've done all that, I will then assemble my needle, do it as best as I can to make it sterile. Re-inspect my medication, make sure it's the correct one, clean the top of it. Pull back 1 milliliter of air. Inject 1 milliliter into the vial. Pull out 1 milliliter. Okay. There we go. Push all the air out. Put my top needle into the sharps container. Take my atomizer. Place it on top. Go over, cease ventilation of my patient, inspect the nostrils to see which one is the largest as well as the least obstructed. Once I discover that, I will then take my atomizer, insert it into the nostril, administer the medication briskly, and then I will resume ventilation of my patient, and then what am I thinking? Evaluate for any non-desired side effects. Is that 3 or 4 attempts that I've done so far? That was 3, right? Yeah, I'm on my 4th. Okay. Start off, check with your patient to see if they have any known allergies. Explain to them the procedure of what's going on. So, so talk with them and inform them that you're going to be administering medications into their nostril, and they may feel some discomfort, but it's intended for them to inhale this medication. After I've done that, I will find my medication, make sure it's the correct medication, I have the correct dosage, I'm going to be giving it at the right time, as well as I can give it the right route, so intranasally. I'll inspect my medication, make sure it's not expired, make sure that it has clarity, and then I will also check with my patient for patient identifiers, 2 patient identifiers. Next, I will assemble my needle as sterilely as I can. Draw back to 1 milliliter of air, insert it into my vial, push it all in. Okay. Remove all the air bubbles. Take this, place it in the sharps container, put on my atomizer, and then I will then cease any form of ventilation. I will go over and inspect my patient's nostrils to see which one is larger, is least obstructed. Once I find that, I will then take my atomizer, go stick it inside the nostril, administer the medication briskly, then resume ventilation and evaluate for any non-desired side effects. Okay. Attempt number 4. Gather up all of my materials. Explain to my patient the procedures that is going to be going on. I will explain that this is going to be a medication that will be administered into their nostrils. They may feel some discomfort, and the intent is for them to be inhaling the medication. Next, what I will do is I will find my medication, check that it's the right medication, that it's the right dose of it. I'm going to be able to give it the right route so I can give it intranasally. Next, I will be making sure that I have the right amount. I will check the clarity of it as well as the expiration date, and I will check with my 2 patient identifiers to make sure that I'm giving it to the right patient. Next, what I will do is I will assemble my materials. So I got my needle, check my medication one more time. It's correct medication. Clean the top of it. Pull back 1 milliliter of air. inject it into my vial, pull it out. Okay, pull out my medication, get all the air bubbles out. Okay, remove this, place it in the sharps container, put on my atomizer, cease any form of ventilation, go over and inspect my nostrils to see which one is bigger, has the least amount of obstruction. Then I'll go in and insert the medication briskly, and then I will place all of this into the sharps container, resume ventilations, and then check for any undesired side effects. Okay. Start off by making sure, temp number 5, start off by making sure that my patient is being ventilated adequately. Go over and ask them if they have any known allergies, explain the procedure. So we are going to be administering a medication into your nasal passage. You may feel some discomfort, but this is intended for the medication to be inhaled. You go over, you gather all of your materials, inspect your medication, make sure that it's the right medication. You can give it intranasally, that you have the right dosage of it, check the clarity of it, expiration date, check to make sure that you're giving it at the right time, and then use your 2 patient identifiers to make sure that you are giving this to the right patient. Assemble your materials as sterilely as you can. Go back, re-clean the top of your vial, check to make sure that this is the right medication, grab your needle, pull back 1 milliliter of air, inject that into your vial, pull that out of your vial, remove any air pockets. Okay, take this, put it in the sharps container. Since this was my 5th attempt, I am actually going to be placing it in our sharps container. I have another one. Put on my atomizer. Then I will cease any form of ventilation. I will inspect the nostrils to see which one is the least, see which one is largest, as well as has the least blockage. I will then insert the atomizer into that nostril. I will then insert the medication briskly. I will put all of this into the sharps container, resume ventilation, and then monitor my patient for any undesired side effects. I mean, if you so wish. Okay, gotta refill up my vial.
Can you scoot in the shoe? I don't know why. Can you scoot in there?
Okie dokie. Setting up drainage. Okay. Get that out of the way. Alrighty, this is my official attempt at providing a intranasal medication. Okay, so to start off, I'll be gathering up all my materials, make sure that my patient is being ventilated adequately. She's breathing on her own, so don't need to be doing anything with that. Next, what I'll be doing is making sure that if they have any type of allergies. So, do you have any allergies to medications?
Nope.
Nope. Cool. After discovering that information, I will ask her, can you tell me your name and your date of birth?
All 12/13/99.
Cool. Then next what I'll do is I will grab my medication. I will inspect it to make sure that it's the correct medication. I can give it a intranasally. I'm also going to check to make sure that it is the right dosage of the medication, look at the clarity of it, check the expiration date, as well as I will check to make sure that I'm giving this at the proper time. Next what I will do is I will try and form my needle and open it up as sterilely as I can. Okay. Next I will put on gloves. Inspect my medication one more time. It's the correct one. Clean the top of it. Okay. Going to fill up 1 milliliter of air. Inject it into my vial. Alright. Remove all the air bubbles out of it. There we go. Okay, take this, put it in my dandy little sharps container. And then I will take my atomizer, put it on my put it on my needle. I don't know if I did this before, but kind of to explain the procedure that's going to be going on, I'm going to be administering this pretty quickly into your nose. You may feel some discomfort, but it's intended to be inhaled. Okay? Well, go into your nose. But if there was any type of ventilation, this is whenever I would cease it, and then I will go and I will inspect which nostril is larger, see which one is the less blocked. Okay, that would be this nostril. So then what I would do is I would take my atomizer. I'm actually not going to shove this up your nose, but I would take my atomizer, I would put it up the patient's nose, inject all the medication briskly, and then if they were being ventilated, I would resume ventilations. I would then also take this, put it in my sharps container, and then I will observe for any undesired side effects. Thank you.